Welcome to the 2020 benefits presentation for Great Dane Petroleum Contractors. When you have questions regarding your benefits, your contacts can be found on page 1. Your contacts at Great Dane, Brown & Brown, your benefits broker, your medical carrier, your dental, vision, disability, and life carrier. Throughout the year when you have questions, please ask the people listed here. Your medical coverage is with Cigna. Cigna Open Access Plus is the network that you want to use to get the best benefits. You can follow the instructions listed here to look for providers in the network. Once you are enrolled, you can log in as a registered member. The system will recognize your network, Cigna Open Access Plus. You can download the My Cigna app for your smartphone to search for providers from your phone. And you can also call the 800 number on your ID card if you're in a pinch and need to be referred to a physician that is in the network. You can see your weekly costs listed below for plans 1, 2, 3, and 4. Here we have the 4 plans side by side. Plans 1 and 2 have in-network only benefits. If you are going outside of the network, you will not have any coverage unless it is for an emergency room visit or ambulance transportation. Those services are always covered in or out of network. Plan 1 does not have a deductible or coinsurance responsibility. You have copays for practically every service. Your plan year maximum is $2,000 per person. The plan year begins April 1st and resets the following April 1st. This is what you are liable for in-network covered services. Your preventive care is covered at 100%. That's your routine annual wellness exam. Telehealth virtual visits are available for just $25 per consultation. This is where you can have a FaceTime video chat with a doctor, available 24 hours a day, 7 days a week, 365 days a year. These are board-certified physicians that can diagnose, treat, and write prescriptions. Think about common colds, flu-like symptoms, UTI, pink eye, rash, and more. If you need to see a physician in their office, you'll pay $25 for a primary care physician office visit. Think family practice, general practice, internal medicine, pediatrician. Everyone else is a specialist, and you'll pay a $45 copay per visit. Urgent care visits are $75 on Plan 1. An emergency room visit is $150 per visit. Plan 2 has a $1,000 deductible that runs the plan year, April 1st through March 31st. Everything resets to 0 on April 1st annually. No coinsurance responsibility after the deductible has been met. You do have copays for a lot of services. The out-of-pocket maximum on Plan 2 is $4,000 per individual. That is the most you're expected to pay during the plan year, April through March. Any deductible or copays that you pay go toward the out-of-pocket, and if you met your out-of-pocket maximum, you'd be done paying for claims that year. Preventive care covered at 100%, telehealth virtual visits, office visits. You do have a $50 copay for urgent care visits. It's a $250 copay for the use of the emergency room. However, the physicians that treat you on Plan 2 in the emergency room will be subject to your deductible. So it can be very expensive to go to the emergency room for a very minor reason. So please use telehealth virtual visits or urgent care visits. Plans 3 and 4 provide benefits in and out of network. You are subject to separate and higher benefit responsibilities outside of the network plus balance billing, so you still want to make it a priority to stay in network with plans 3 and 4. Plan 3 has a $1,000 deductible for some services. Once the deductible has been satisfied, the plan will pay 80% of the remaining covered charges. You're liable for the other 20%. And when your deductible, coinsurance, and all of your copays add up to $3,500, you've met your maximum for the plan year on Plan 3. Preventive care covered at 100%, $25 virtual office visits. You've got your office visit copays, your urgent visit copays, and then your emergency room visits. Similar to Plan 2, but you have that coinsurance responsibility on Plan 3 that you don't have on Plan 2. For Plan 4, you have a $2,000 deductible per person. Once satisfied, the plan will pay 70% Other remaining covered charges, you're liable for the other 30%. When your deductible, coinsurance, and copays add up to $6,350, you've met your limit on Plan 4 for that plan year. Preventive care covered at 100%. Your virtual office visit copay is $35 per consultation. Your physician office visit copays are slightly higher than the other plans, and your urgent care visits are subject to deductible and coinsurance. So you definitely want to stick with the virtual visits when possible. Emergency room visits have the copay for the use of the emergency room. However, the physicians are subject to the deductible and coinsurance. So again, urgent care or telehealth is going to be less expensive than an emergency room visit. Continuing with the benefits on the next page, independent clinical labs are covered at 100% on all 4 plans when you visit Quest Diagnostics or LabCorp. X-rays are covered at 100% at independent diagnostic testing facilities on all 4 plans. Advanced imaging services are subject to a copay, which varies by plan. An independent diagnostic testing facility example would include ProScan or Radiology Regional. If you visit the hospital on an outpatient basis on Plan 1, your services are covered in full. On Plan 2, you have a $350 copay for the hospital facility. The doctors are covered in full. You are subject to your deductible and coinsurance on Plans 3 and 4 for an inpatient or outpatient hospital setting. For an inpatient hospital setting on Plan 1, there is a $500 copay for the hospital facility. Physicians are covered in full. There's a $250 copay per day on Plan 2. That is for the hospital facility. Physicians are covered in full. Remember, with all of these plans, you have a plan year maximum, and when your deductible, coinsurance, or any copays accumulate toward that maximum, once you've met the maximum, you are done paying claims that year. Every April 1st, the slate is wiped clean, and you must start paying claims again. Your prescription copays on Plan 1 are $15 for a 30-day supply of a Tier 1 medicine, $35 for a Tier 2 medicine, and $60 for a Tier 3 medicine. On Plans 2, 3, and 4, your Tier 1 medications are $10 for a 30-day supply, $50 for a Tier 2 medicine, and $80 for a Tier 3 medicine. Some tips that are important. Keep these in mind. Keep your benefit information handy. Check out the benefits on Employee Navigator from time to time. You can view Employee Navigator from your smartphone simply by logging into employeenavigator.com. Stay in network. Your network is Cigna Open Access Plus. You can look online or you can call Cigna 24/7. This is a nationwide network. Your coverage travels with you as long as the provider is in the Cigna Open Access Plus network. Wherever you are able to stay in network. Quest Diagnostics and LabCorp are your preferred labs, covered at 100%. 24/7 customer service is available. Member website is mycigna.com. Log in as a registered member, set up your username, password, access your benefits, the provider directory, your ID cards, claims, do some cost comparisons, and more. Get the MyCigna app for your mobile phone for access on the go. Make sure you pay attention to the explanation of benefits mailed to your home, always available online at mycigna.com. Match those explanations of benefits from Cigna up to a bill from a provider, and make sure you are only paying for what you are responsible for. Remember, urgent care is going to be less expensive and more timely than the emergency room, and better yet is the telehealth virtual visits. Cigna has a list of no-cost medications. Log in as a registered member to view the prescription drug list and switch to those medications if you can. Fill generic whenever possible. This saves you and the plan money. If you fill brand while generic is available, you will be penalized. So talk to your physician about switching to generic. Take advantage of local discounts at pharmacies such as Publix, Walmart, and Winn-Dixie. Ask your doctor about samples. Look for manufacturer assistance or coupons at Needy Meds, GoodRx, and Blink Health. If you're not a registered member, you can view the prescription drug list by going to Cigna.com/drug list and search the Advantage 3-tier prescription drug list. You want to be familiar with which medications are not covered, which have a prior authorization, quantity limitation, require that you try and fail a prerequisite, step therapy, or are specialty pharmacy and only covered through a specific pharmacy. As a member of Cigna, you get to take advantage of lots of different discounts on weight management, nutrition, fitness, mind, body, vision, hearing, alternative medicine, and more. Cigna has a nurse line that is available 24/7. There is no cost to this service. So before you use the telehealth virtual office visits and incur a $25 or $35 copay, you might want to try the free nurse line and get some guidance from them on where you should go for your care and treatment. So know before you go, 24/7 nurse line is free. Cigna Telehealth, you can use Amwell or MD Live. You want to set up your account, register now ahead of time. If you find yourself sick with a rash, you need a short-term refill of a prescription, telehealth doctors can help you with that. It's like setting up your new patient file at a new doctor's office, so take 10 or 15 minutes to set up your account with both options. Download the apps to your smartphone, and then when you need the services, you will be ready to request that consultation, and within 9 minutes usually you are speaking with a doctor, and 5 minutes later your prescription is being filled. A little bit more expensive and more labor intensive is going to a convenience care clinic like a Minute Clinic, doctor's office, urgent care, more urgent, more expensive, and then finally the emergency room. So this gives you an idea of the cost and the reasons you would use the different options. If you need to fill a 90-day supply of your medication, you can use the home delivery service, or you can fill your prescription at a CVS, including Target or Walmart. Those are the only local pharmacies where you can pick up a 90-day supply. Otherwise, you have to get a 30-day supply if you're using Walgreens or Publix. So if you want to be able to pick up 90 days at once, it must be a CVS, including Target, or a Walmart. If you want to use the home delivery service, you want to get your 90 days filled and delivered to your home. You don't want to have to drive to the pharmacy every month or every 3 months. You want the U.S. Postal Service to deliver that medicine to you. You can sign up for the home delivery. You can either fill out a form and send it in with payment method, or you can have your doctor request the prescription for you through fax. And then you put your payment method on file. They will ship the medication to you. When you start to run low, you call and request a refill, or go online and request a refill. And about a week later, you have your next 90-day supply in your mailbox. A new program is available starting April 1st. If you take insulin, including Basaglar, Humulin, Humalog, or Levemir, this will cost you no more than $25 for a 30-day supply. If you are taking these medications, please make sure that you reach out to Cigna and make sure that you are eligible for this program and start paying just $25 for a 30-day supply of these insulins. There are some online coaching programs available. We want to make sure you realize that these are out there. These are self-motivated, so make sure that if you're interested in making any changes to your lifestyle, that you take advantage of the programs available at mycigna.com. You can control your stress, lose weight, eat better, exercise more, quit tobacco, manage your diabetes or heart disease or heart failure or COPD and asthma. So make sure that you log on to mycigna.com as a registered member, take advantage of all these health programs, and always call Cigna if you have any questions. mycigna.com. It is easy to register, and you get a plethora of information at your fingertips that make your lives easier when it comes to dealing with health insurance and health care. And again, if you get the My Cigna app on your phone, it is pretty much the same access, and it's available when you're out and about and on the go. Looking for providers in the network, looking at your claims, understanding your benefits, pricing what a prescription costs at 2 different facilities, pricing what an x-ray costs at 2 different facilities, finding out if there's a less expensive drug in the same therapeutic drug class as your tier 3 medicine. Pulling out the drug list on your phone in the doctor's office can save you time and money. Dental, no changes to the benefits, a slight increase to the dental rates. Dental is available through Mutual of Omaha. You can go to the mutualofomaha.com/dental website to look for providers in the network. The dental benefits are richer if you visit dentists participating in the network. Your type A services are covered at 100%, no deductible. The deductible, which applies to your type B and C services, is $50 in network. It's a $100 deductible if your dentist is not participating in the network. The annual maximum, which is the most the plan will pay per person per year, is $1,500 in network or $1,000 outside of the network. Orthodontia coverage is available for your children only. There's no deductible. The plan will pay up to $1,000 once per child per lifetime. So again, you can see your type A services covered at 100%. Those would include exams, x-rays, cleaning, fluoride treatments, sealants, space maintainers. Your type B services, which are subject to the $50 deductible in network, $100 deductible outside of the network, are covered 90% by the plan, 10% by you in network after the deductible, or covered 80% by the plan and 20% by you after the deductible outside of the network. Type B services include your fillings, extractions. Type C services, also subject to the $50 or $100 deductible, are covered 60% by the plan in network. You pay the other 40%. It's a 50-50 split outside of the network between you and the insurance company. Type C services include oral surgery, root canals, crowns. Your orthodontia services for children only are not subject to the deductible. It is a 50-50 split between you and the insurance company, and the insurance company will pay up to $1,000 once per child per lifetime for orthodontia services. Again, the type A, B, and C services are covered up to $1,500 in network each year, and then out of network it is a $1,000 benefit. You are encouraged to request a pre-treatment estimate. If you're going to have a type B or C service performed, get it in writing first that it is going to be covered and how much is going to be covered. You might be nearing the end of your benefit. You might have had the plan already spend $1,200 on you. There's only $300 left. You're about to have a crown performed, and that crown is estimated to be $1,000. That's going to leave you with a very large bill. However, if you wait until the next year when the benefit resets, you'll get a brand new $1,500 benefit, and then there will be more coverage from the dental plan. So always ask your dentist for a pre-treatment estimate and know upfront what the service is going to cost you before you have it performed. There are some limitations and exclusions, some age and frequency schedules. That again is why it's very important to get that pre-treatment estimate performed. You might be going in to have work done 2 years too soon or 2 months too soon, and you don't want to be stuck paying a very expensive bill because you went in too soon for a service. There is a hearing discount program tied to the dental plan, so make sure you take advantage of that if there is a need. Vision insurance is available through Mutual of Omaha. Go to mutualofomaha.com/vision to look for providers in the network. No changes to the vision benefits or rates. With vision, it is important to stay in network. The benefits are much better when performed by an in-network provider. If you go outside of the network, you will have to pay for your claim. Then you will have to file your claim and then wait for a reimbursement up to the benefit amounts listed here. So your benefits in network, you'll have a comprehensive eye exam covered subject to a $10 copay. There are some additional exam options that you can choose for an additional cost. Frames are covered up to $130. Anything over and above that would be discounted. There is a $25 copay for your lenses. If you need progressive lenses, that is a little bit higher of a cost. And if you need any premium progressive lenses, that is an additional cost as well. Lens options, some of them are available at no cost. Polycarbonate for adults is an extra $40. If you need anti-reflective, that is $45, transition $75, and there's additional add-ons that are available at a discount. Contacts are available in lieu of glasses. You get the $130 allowance plus a discount on any balance over and above that. Your frequency schedule. Exams covered every 12 months, lenses covered every 12 months, frames covered every 12 months. Again, there is a hearing discount program tied to the vision plan, so if you need that and you don't have the dental, you could take advantage of it here. The voluntary life insurance is not changing, no benefit or rate changes. However, if you have this benefit already, you will know that your rates are based on your age. And as you get older and enter a new age bracket, your rate is going to change. It is going to increase. When you log on to the enrollment system, you will see the benefit and the rate based on your age. So it is possible that some of you will see a rate increase because you have entered a new age bracket. The minimum benefit for employees is $10,000. If you are a new hire, you can get up to $100,000 guarantee issue, no questions asked. The most you could apply for is $500,000 or 5 times your salary. For your spouse, as long as you have this benefit, you can cover your spouse a minimum of $5,000. $30,000 is the guarantee issue benefit. $250,000 is the max you could elect for your spouse. $10,000 is the benefit for your children. If you are a new hire, you can take advantage of the guarantee issue benefit, but if you're not a new hire and you want to apply for this coverage, you must complete an evidence of insurability form. Your application is subject to underwriting and can be approved or denied. As a new hire, you are guaranteed the guarantee issue benefit. So if you apply for more, you have to fill out the evidence of insurability form, and if denied, you are only denied for that additional benefit. As a new hire, you cannot be denied the guarantee issue coverage. Rates are based on your age. They go up every 5 years, so as you get older, this will become more expensive, but is a very easy benefit to apply for and pay for through payroll deduction. So if you need life insurance to take care of your loved ones, consider signing up for the voluntary life insurance. The coverage is portable and convertible, which means if you leave the company, you could take this policy with you. You have up to 31 days to contact Mutual of Omaha and inquire about your individual purchase rights. The hearing discount program is also tied to the voluntary life benefit. And there is an age reduction schedule. So when you turn age 65, the benefit you have will be reduced, and the benefit will terminate for your spouse when you reach age 70. Voluntary short-term disability is available, no change to the benefits or rates. This is available to new hires on a guarantee issue basis. It is subject to underwriting for anyone that does not currently have it and wants to apply for it now. So your application is subject to approval. Short-term disability will help supplement your missing paycheck when you can't work due to an off-the-job accident or due to an illness. The benefit begins after 7 days of disability. It is a percentage of your weekly income, 50% of your weekly income, to a maximum of $1,500 a week for a maximum of up to 25 weeks. So if you can return to work after 6 weeks, great. If you're out for longer than that, 25 weeks is the maximum benefit duration for short-term disability. And the hearing discount program is also tied to this plan. Voluntary long-term disability. This benefit would kick in after 180 days. So this kicks in after 6 months of disability. You may be able to go 6 months without a paycheck. You don't need the short-term disability. It's the long-term you're more concerned with. Or you may want just the short-term, or you may want both. This is also guarantee issue for new hires, subject to evidence of insurability for everyone else. It is 50% of your monthly income to a maximum of $6,000 a month until you are able to return to work or your normal Social Security retirement age. Evidence of insurability necessary if you are applying for voluntary life in excess of the guarantee issue amount or for the first time and you are not a new hire. Evidence of insurability is required if you're applying for voluntary short-term disability or voluntary long-term disability for the first time and you are not a new hire. So you can go to mutualofomaha.com/EOI to fill out an electronic application. You'll need to have your group number handy. Your group number is listed at the top of the form, G000BJ8H. And then answer all of the questions you are asked. You will get a letter in writing confirming or denying your application. Employees working 30 hours or more per week are eligible for these benefits after 60 days of employment. You can cover your legal spouse or your domestic partner, and your children are eligible to be covered through age 26. All employees must complete an enrollment form to confirm their benefit elections for the 2020 plan year. During open enrollment, you must make your decisions no later than Friday, March 13th, 2020. Your elections will take effect April 1st. So however you're enrolled today, you can make changes through March 13th for an April 1st effective date. If you are a new hire, you will make your benefit elections. They will take effect on the first of the month following 60 days of employment, and then you cannot make any changes to your benefits until the next open enrollment, unless you experience a qualifying event. Qualifying events are outlined below. You get married, you have a baby, you get divorced, you lose health insurance, you gain access to health insurance, whether it's you, a spouse, or a child. If you lose or gain access to coverage, you can join or drop the coverage, so long as you contact HR within 30 days of the qualifying event.